Hello friends, let us now learn some important points about the image characteristics in the fluoroscopy. So image which is produced from fluoroscopy will have certain characteristics. One, the contrast of the image. The contrast of the image is determined by various ways. There is not one agreement is not seen. The one example of finding the contrast or determination of contrast of the image is that if this is the input screen, so this is the input screen, right? To this input screen in the center, I will place a thick lead disc. So this thick lead disc of around 1.1 by 4th inch thick lead disc is placed at the center of the input screen in such a way that this thick lead disc will cover 10% of the screen, whereas the rest of the 90% of the screen um, is covered by the input phosphor. Okay, now this X-rays are now exposed to the input phosphor. This lead disc will absorb this part of the X-rays, right? This part of X-rays are absorbed by the lead disc. Okay, now the input phosphor is exposed to the specific quantity of radiation, and at the output phosphor the brightness has been measured. We will measure the brightness ratio at the output phosphor. So if we see in this way, the contrast ratio ranges will be ranges from 10 is to 1 to 20 is to 1 depending upon the manufacturer and intended use. There are two factors which will diminish or decrease the contrast of the image. The contrast of the image is decreased in the image intensifier by two ways. One, the input screen which is present here, input fluorescent screen, it does not absorb all photons in the X-ray beam. It does not absorb all photons from the X-ray beam, meaning that few photons, not the electrons, few photons, very few amounts of photons are transmitted through the intensifier tube, through the input fluorescent screen, and few of these transmitted photons will reach the output fluorescent screen, and they are absorbed in the output fluorescent screen. This output fluorescent screen, when they are absorbed, so the photons which are released from this output fluorescent screen, few of the photons are, so the light photons which are released from the output fluorescent screen, few of them are from these transmitted photons. When these transmitted photons will produce the light photon from the output fluorescent screen, this will result in fogging of the image, and because of this fogging of the image there is decreased contrast. So number one is due to the transmitted photons. Transmitted photons which are transmitted from the input fluorescent screen. Next, the second reason of uh, decreased contrast is because of the from the output fluorescent screen. The second thing is that there are electrons which will pass here, the electrons from here, the electrons from here. Sometimes the electrons from here they activate the output fluorescent screen, which will result in production of light, right? Sometimes what happens is the light, instead of flowing in the forward direction, it will start flowing in the reverse direction. So this is called as retrograde flow of light. When there is retrograde outflow of light, this will also causes some of the light to pass through the aluminium, and through the there is a aluminium protector, aluminium, which will prevent the retrograde flow of light. But sometimes it may allow the photons to pass. Sometimes some photons may penetrate this aluminium also, and they pass back through the image tube, and they might sometimes reach this photocathode, and they will activate the photocathode. The photocathode will again emit the electrons from the retrograde light which is obtained from the output fluorescent screen. So this retrograde light which is obtained from the output fluorescence will also result in fogging again. So the end result of this contrast, decreasing contrast, is nothing but fogging of the screen. So this is about the contrast. The next second characteristics of the image is distortion. Not distortion, sorry. Second characteristic is lag. So what is lag? Lag is that the here in the image intensifier, even here X-rays will stimulate. What will happen is that these X-ray photons will stimulate the input for fluorescent screen. This input fluorescent will produce light, right? So sometimes there is this input fluorescent screen will have persistent luminescence. Persistence of luminescence is seen in the input fluorescent screen, and this light will activate the photocathode. So this persistence of luminescence by the input fluorescent screen is called as lag. This lag is around 30 to 40 milliseconds in the older tubes which are made up of made up of silver coated zinc cadmium sulfide. But nowadays we are using cesium iodide tubes which have a lag of around 1 millisecond. It is very less. But previously there is a lag of around 30 to 40 milliseconds. Next, this is the second one. Then the third characteristics of the image is the distortion. What does distortion mean? Distortion. The See, the central electrons which are obtained from the X-ray image intensifier will directly go and they will hit the output phosphor. Very good. But the peripheral electrons sometimes they may not strike the output phosphor. The peripheral electrons may flare from their ideal course and they may go into different directions. When they go into different directions, this will result in something called as unequal magnification. This unequal magnification will result in peripheral distortion. This amount of distortion is more. It is more for larger intensifiers when compared to the smaller intensifiers. So whenever we use a larger intensifier, this will result in distortion. In distortion, the image will curve out at the periphery. You can see the mesh wires, which is very thin, straight mesh wires. But here you can see the curving of the mesh wires is seen peripherally. So this curving out at the image being curved out at the periphery, this gives an effect called as spin cushion effect. This distortion will not decrease the routine fluoroscopy, but this unequal magnification will cause unequal illumination, and as a result, the central screen, the center of the output screen will be brighter when compared. Sorry, the center of the output. So when you use something like this, the center of the output screen is brighter when compared to the periphery, and the peripheral image is actually distorted, that is curved. This decreased brightness at periphery is called as vignetting. This decreased brightness at the periphery is called as vignetting. So these are the three important characteristics, image characteristics in fluoroscopy. Thank you.